Hi, everyone. Welcome to the Sports Docs podcast. On each episode, we chat about the most recent advancements in the field of sports medicine with experts from around the country. Today, we're coming to you live from the 10th Annual Arthrex Team Physician Controversies Conference in Naples, Florida. I'm Dr. Ashley Bassett.
And I'm Dr. Catherine Logan. The Team Physician Controversies course is a 2-day event that brings together world-class surgeons who are working with both professional and collegiate athletes. We're going to be doing case-based discussions of diagnosis, treatment options, as well as return to play. And we are lucky enough to bring together experts into the studio to discuss the latest techniques.
So we are joined today by Dr. James Voos, Chairman of Orthopedics at University Hospitals and Case Western Reserve University, as well as the Medical Director of the UH Struzinski Sports Medicine Institute. He also serves as the head team physician for the Cleveland Browns and Medical Director for the Cleveland Ballet. Dr. Voos is an expert in advanced imaging tools, so we're really excited to have him join us today to talk about Arthrex's suite of imaging technologies, which includes the NanoNeedle, PanoScope, Synergy Vision, and importantly, how they're impacting practice, outcomes, and OR workflow. Dr. Voos, welcome to the show. Welcome back to the show.
Thank you very much. Great to see you.
We're excited to have you. So in today's episode, James, we're exploring game-changing imaging technology, and it's going to refine how we see things, how we treat things, as well as our ability to get to nooks and crannies around the joint. So we're going to kick off things talking about nano-arthroscopy. So from its inception in 2019, nano-arthroscopy has truly advanced as far as what we're able to do. So can you speak a little bit to your use of nano and how it's changed?
The NanoScope and nano-arthroscopy has really changed my practice, and I really took it in a graduated approach as to how to use it on the care of our patients. And it's one of those technologies where we want to continue to challenge ourselves to find better ways to take care of our patients. Are there less invasive ways to take care of our patients? Yeah. So I initially started using it in procedures like ankle fractures, where we want to look inside the joint before we fix the fracture, and elbow arthroscopy, and particularly when we're doing elbow arthroscopy on adolescents, when you want to make very small portals or you have a very small person you're operating on. So the comfort level with those to be very minimal and to be able to look in those small spaces was really encouraging. To now it's become much more of a process that we utilize in our surgeries. And an example is in a busy OR day where we may have 8 surgeries in our room, and then our colleagues next door doing the same thing. The burden on our cameras is very high and the turnover is very high. So being able to add this into our armamentarium is one other tool to decrease the burden on our regular arthroscopes.
Absolutely. And it seems like there's definitely been an advancement in the resolution from the original NanoScope to what we have now. So moving away from those grainy images and that limited field of view. So patients also appreciate that limited kind of minimally invasive approach that NanoScope offers. So what kind of questions are patients typically asking you when you're talking about doing a nano-arthroscopy?
The first thing everybody wants to know is how fast can I get back to play?
Yes.
And so I think it is one of the types of technology where we can make smaller incisions and cause less trauma. So I do think that contributes to it. And I really think they like knowing that new technology is being used on them. I think they like that their physician cares about being delicate with their body and being minimally invasive. So all of those have been a big advantage.
Absolutely.
Great. And James, let's now talk about how do you add it to your practice. So you talked about for yourself, it was a graduated approach. If someone was to come to you now and say, I'd like to add this in, I'm a little hesitant or I have some hesitations, how would you add nano into the practice?
The first thing is speaking with your representative of doing a lab with it, and getting and doing it on a cadaver or a sawbones helps you realize the confidence you have in the image, and particularly the new versions here have wonderful resolution. So those labs of showing yourself, boy, I really can see things. And the other part with the lab is then you can start to look and realize I can see in the back of the knee, or I can see in the spot that I couldn't before. Gives you the confidence to then go add it into a case. And then pick a couple simple cases, and maybe it's not an ankle or an elbow. Maybe you want to do it on a regular knee arthroscopy or a meniscectomy that you know is a very contrite procedure there to introduce it to. So.
Absolutely. Great advice.
So all those advancements, they really have a real world impact on our day-to-day practice. Can you expand on that? How do you feel access to these technologies has changed your practice or your diagnostic abilities at the time of the arthroscopy?
Yeah, it's been incredibly helpful. And an example is on several of our professional athletes where we may need to do a staged procedure for a very severe multi-ligament injury. If we're working around the edges on a bad MCL or a posterolateral corner, I've used the NanoScope to look inside the joint to be confirmatory. Is the ACL really torn or not? Is there a cartilage injury or how bad is it? So for me, it's been very helpful to confirm the diagnosis and know how to stage some of these procedures. That's probably the area where it's helped the most. And then ultimately, when you're talking with the athlete, knowing you have all of these options, we will likely maybe talk about the panoscope there as well. But for me, knowing I have this menu of things that I can go and take the absolute best care of the patient with each of these selections of imagery.
Absolutely.
Yeah. And as you know, if we can't see it, we can't treat it.
Right.
So being able to see it. I wanted to sort of focus a little bit on, if you have a partial rotator cuff tear or meniscal ramp lesion, these are areas that I think this imaging technology helps us sort of understand so that we don't miss a pathology that perhaps we were missing before, getting somewhere far back in the knee and really assessing the root better. But what about the learning curve? Is there a big learning curve to integrating this technology in practice?
Remarkably, it was very easy to integrate into practice. And particularly when you can see more, it's very encouraging every time you use it. And being able to sneak around and look in those additional locations it's very liberating to know that you can see all these other places. I think the biggest learning curve is actually the reduced burden on your body. It's very light. It's like holding a pencil in the operating room versus a scope. And we all know at the end of a long day, your hands are almost feeling crampy. And so having these smaller, lighter scopes has an ergonomic component to it as well.
Great point.
That's great. So you mentioned the panoscope. That's where we want to go to next. So let's talk a little bit about the panoscope. So traditional scopes, they show you a tunnel. Panoscope lets you see more of the joint without having to switch from a 30 to a 70 or constantly switching portals. So from your perspective, are you seeing objective improvements in your diagnostic abilities at the time of arthroscopy? And how do you think this will ultimately impact patient outcomes?
I've absolutely loved the panoscope. We have fully integrated this into our practice. And my practice is primarily an ACL practice where that's the most common surgery I do. And I utilize through the lateral portal a 70-degree scope to look around the corner and to see the wall and to drill my tunnels. And I've done that through my whole career. And you always have to switch the camera back and forth, and it takes a little bit. And then you hope you open it up and it's actually the 70-degree scope that's in your tip. And so having the panoscope to switch from the 30 to the pano to the 70 is with the push of a button allows you to work around the corner. And then if you're going to go back and look at the meniscus or get a loose body, for me has been an incredible efficiency part of the procedure. And the resolution is excellent. Similar in a Bankart procedure where you want to look all the way around the front of the glenoid where you normally have to switch the camera. Now you can switch to the pano or the 70-degree view and look all the way around the front and find the labrum to lift up. So it's a thing I use every day in practice, and I'm thrilled that it's all incorporated into the push of a button so we don't have to switch out the scopes anymore.
Absolutely.
Yeah, I was just going to bring up some of those other joints, the shoulder, the hip. Obviously, you're running the department. So you have partners who are doing procedures that you aren't doing. How are they integrating this type of technology?
Yeah, this has been one from the operating room staff to not have to worry about the 30 and the 70-degree scope, and those that are doing hip arthroscopy or other, to know that it's all in one camera has really simplified things for all of our partners. And now more and more, even in ankle arthroscopy and hip arthroscopy, everyone's adapting it. A really unique one is a lot of our surgeons that do patellofemoral surgery sitting back in the pano view when you can see the entire patellofemoral joint, the depth of the trochlea, where the patella is sitting. It really helps you to plan your surgery much, much more precisely.
Yeah, and briefly, you brought up the ankle. That was the first time I had used nano technology. It was an ankle fracture, to say I want to go look in the joint after and make sure the joint looks okay. And that, there's lots of different ways it can be used as an adjunct.
Absolutely. So NanoScope and the panoscope, the synergy vision system really ties it all together, allowing for dual visualization with the NanoScope and the panoscope. How does that level of visualization affect OR efficiency? Are you typically doing dual visualization at the time of surgery?
One of the areas where we've really looked to adopt this dual visualization is in PCL reconstructions, where I no longer utilize fluoroscopy during the placement of the tibial tunnel. So I use the NanoScope is my nanoscopic fluoroscope. where I can put the NanoScope in the posterior medial portal and watch the pin come out and look directly at it. So that has eliminated fluoroscopy in the room for me, where I feel like I can safely care for the patient. There's no radiation exposure to the patient, to myself, or to the staff. And you get wonderful visualization back there. So that's an example of how we've been able to use both of these at the same time, really to change the surgery and get one other. I think that's a safety factor as well, getting the X-ray out of the room. So.
Definitely.
Yeah, it's one of the most stressful parts of being a knee surgeon is making sure you're okay back there posteriorly. So that's a great use, and I think that's a great pearl. As far as putting it all together, did you integrate just first with Nano and then start to integrate other things, or what was the evolution for your department?
The NanoScope was available to us first. And our representatives were really good in terms of making sure we had the appropriate boxes, and it was available at all of our locations. So that began our integration first. As soon as the Panoscope came out, we couldn't get it out of the package fast enough here to use it. So that followed, and it happened to coincide as we were opening some new operating rooms. So it was really nice to have open a new facility with all of this brand new technology integrated in with it. So it was very quickly adopted, and I had been watching for it for quite some time. The really exciting part is seeing our partners that did not know about it or may have been skeptics adopting it, and now all of a sudden you peek in the room and they're using it all the time. So it's a great thing to see.
Exactly. Now you mentioned, this new technology. So let's talk a little bit about the future. So where do you see the next innovation or the next, imaging technique in arthroscopy taking place in terms of the Panoscope, the NanoScope? Like, where do you see it going from here?
As the imaging continues to improve, and it's hard to imagine it improves even more because it's so good, but I do think it helps us in this progression of, can we move to procedure rooms or potentially office-based procedures? Now that the imaging capabilities are there, I think the instruments will follow behind to allow us to do that, and our anesthesia techniques. So I think that it is a challenge for us as physicians to sort out, can we continue to make this an easier, more pleasant process for our patients? And then the image capabilities, are we able to see three-dimensional, able to see cartilage quality, those type of things I don't think are far behind to get even more detailed information.
Absolutely.
Yeah, those are great progressions, and I think we'd all love to see that for sure.
Definitely. Our patients included.
Right.
Awesome. Well, thank you so much for breaking this down. This has been a really incredible discussion today. Really nice overview of the different imaging software. And so,
Yeah, thanks again for coming back on.
Thank you very much, as always. Congratulations.
And thank you for listening to this episode of the Sports Docs Podcast, live from the Arthrex Team Physician Controversies Conference. Make sure to subscribe on Apple Podcasts, Spotify, Amazon Music, and YouTube to stay up to date on all things sports medicine.